This is Rural Health Leadership Radio.
Episode 173, a conversation with Maggie Sauer, Director of the State of North Carolina Office of Rural Health.
We want to understand more about rural and what the opportunities are. So I think people are really paying attention to rural in a way that they haven't necessarily before.
Welcome to the Rural Health Leadership Radio with your host, Dr. Bill Oxier. Each week, Dr. Oxier has a conversation with a different rural health leader to discuss what's working and what's not working in rural health, along with other topics of interest to rural health leaders. Rural Health Leadership Radio's goal is to improve health in rural America by providing a simple, no-cost means to share information and connect rural health leaders from around the country. And now, here's Dr. Oxier with today's guest.
Hi, everybody. I am your host, Dr. Bill Oxier. Welcome to the Rural Health Leadership Radio podcast. Rural Health Leadership Radio is a 501c3 nonprofit, and like most nonprofits, we're always looking for ways to pay the bills to support our mission, which includes the cost of making this podcast. The cost of today's episode is being covered by me and my company, Bill Oxier Healthcare Executive Coaching, which is part of the Dynamic Leadership Academy for Rural Health. If you're a successful rural health leader and you think you might be interested in becoming an even more effective leader, we should talk. So send me an email to bill@billoxier.com. Now on to today's guest. I want to thank Maggie Sauer for making time out of her busy schedule to have a conversation with us today. Welcome to Rural Health Leadership Radio, Maggie.
Thank you so much for having me, Bill. It's a real pleasure to be here.
Maggie is the Director of the State of North Carolina Office of Rural Health. So tell us about yourself. Who is Maggie Sauer? What's your story?
Well, I am one of those people who came back to rural after thinking that I wasn't going to do rural activities anymore. I actually grew up in rural Colorado, a little town called Lyman, and went to lots of places as a speech-language pathologist. I kind of did that first thing, working with people who had disabilities and working to connect them to technology. So that took me to Wisconsin and Boston and other places. And really, when I came to North Carolina, I really felt the pull of rural again. And so started focusing some of my efforts around doing projects and things around the state that would benefit rural patients, rural activities, rural communities. And so about 2 years ago, I ended up accepting an offer to come and join the Department of Health and Human Services team here at the state of North Carolina, and just feel really privileged and honored to be here as the first Office of Rural Health in the nation.
Oh, wow. That's an interesting journey that you've taken in your career. Why did you choose healthcare as an occupation?
I've always loved science. I loved being able to put things together in different ways. I really like people a lot. And I think, honestly, part of that was just what I saw as I was growing up in rural Colorado. We had really intentionally thoughtful healthcare providers in the community. We only had one physician there at the time. That's changed since now. They actually do have telehealth. But, in the high school I went to, there were all kinds of allied health professionals there as well. So it was speech-language pathology, it was occupational therapy, physical therapy, and they were good enough to let us shadow them, quite frankly. And that just really kind of cinched my interest in science, but also as a helping profession. I think also because I saw to such a great extent about how these folks worked in our community to really help people meet their healthcare needs and provide service to folks in the community.
Very interesting. Yeah, that can be very powerful to do the job shadowing and just getting kind of mentored, whether I don't know if it went beyond that, but it makes a big impact, doesn't it?
It sure does. And I still, some of those folks still are my mentors today. I worked for one of them when I was in graduate school.
Oh, really?
Yeah, he actually was at the University of North Carolina in Chapel Hill, and that's how I actually got to North Carolina.
Wow.
And he himself grew up in rural Indiana. And just really trying to meet the needs of people who he saw had disabilities and needed to use technology. So from my rural roots, people who were local and in the community allowed me to ask questions and shadow them, to someone who was really on a national and international level trying to make opportunities available for people who had disabilities. They kind of took me under their wings and really gave me the opportunity to let me fly.
Yeah, it really makes a difference. Yeah. So why focus on rural health?
Oh, I love rural. I guess it's getting older, and part of, we can all say that, but I just realized that how much rural gave me as I was growing up. The things we take for granted, growing up in rural settings and communities, you participate in it. It's how you're raised. And then you go out into the rest of the world and you see how all of that fits together. And as I've gotten older, I guess I really have a grateful heart. The people who contributed to rural health and how people feel about one another in the community and really try to help each other. In North Carolina, our Secretary of Health and Human Services, Mandy Cohen, says that part of what we're trying to do here in the state is not just pay for health care, but pay for health. And the only way we can do that is the way that we engage communities, engage all parts of the community to talk about health. And I really think that, with rural health, because people are so connected to each other, you have the greatest opportunity to do that.
Yeah, that's very true. So thank you for sharing that with us. The name of this program, Maggie, is Rural Health Leadership Radio, and I emphasize leadership. What's your definition of leadership?
Leadership is holding up opportunities for lots of people to engage in moving ideas, innovation forward, and creating a plan with them to make that happen. Because none of us can do this on our own. I think the best leaders are the ones who create a clear vision and a path forward with the input of the people around them. And the folks who help, from our perspective, giving people the tools they need to really do the best job they can and create the best opportunities and outcomes in whatever kind of work they're doing.
I appreciate your definition. That the key words that rung out to me were opportunities, engage, ideas, innovation, and plan, which are all, you combine all those together. That's a powerful definition of leadership. So thank you so much for sharing that with us today.
Oh, you're welcome. It's there's lots of really good models out there, and I feel grateful for that. So
will you give us an overview of the state affairs in North Carolina?
Yeah, North Carolina is an interesting place because there's things you hear about on the news. There's, lots of different perspectives, I think, about North Carolina, the Southeast, and all that. But I will tell you that one of the things I am just so proud to be part of this team. I mentioned Secretary Cohen earlier in my remarks, but I've never worked in state government before. This is my first time, and I have really come to appreciate what it is that people do as public servants and the dedication that people have to the work here. And I want to say that specifically about the staff here at the Office of Rural Health. We are in an interesting place to be able to work across departments in state government as an Office of Rural Health, and to also inform the department about things that are rural. And so in the last few years, our Governor Cooper, has really embraced trying to reach out to rural communities and create collaboration across departments within state government. And to that point, his appointment of Secretary Cohen, we are all tasked with looking at the ways that we can create a better community to support health. And we don't have Medicaid expansion in North Carolina. I just want to also call out that there are several groups across the state who have worked tirelessly to make sure that people have access to care and access to insurance as much as possible. We're still grappling that in North Carolina right now around healthcare expansion, but I do think that there's this may be an opportunity for us as we've not had in the past.
Very interesting. You talked about the lack of Medicaid expansion in North Carolina. Can you talk about the Medicaid transformation that is taking place in your state?
Yeah, we have. We're moving to Medicaid managed care, which is new for us. We've always had more of a Medicaid plan across the state with the Community Care of North Carolina, which actually kind of started in the Office of Rural Health under Jim Bernstein's leadership. And so many of the states are moving towards a managed care model, which is what North Carolina is doing presently. And we are, I believe, the first state in the nation to have a CMS waiver that will allow us to pay for things that support health, like housing, transportation, food, personal violence resources, and create ways that people can create health outside the doctor's office. So we're pretty excited about that. We've created regional teams in our office to try to assist the people, the safety net groups that we work with during this transition and try to help bring them along. But we're really, really excited about the fact that we're going to be able to not just pay for healthcare services, but try to create relationships in communities that will allow people to access housing, transportation, food, and all those things. And there's been a platform that's called NC Care 360 set up in the state to allow providers to actually connect to those resources and community-based organizations to connect to those resources. So we're in the early stages of it, but I think we're kind of all in on that because in rural counties, those issues are so incredibly important. So we're really excited about it.
Yeah, that's pretty groundbreaking when you think about it. So that's pretty cool. Thanks for sharing that with us. Now, you mentioned that your office is involved. Can you talk a little bit more about that and what all are the different ways that your office is involved in that?
Yeah, so in the early stages, once we got the Medicaid waiver approved, we were included on many of the teams that were discussing how this was all going to roll out. We're now at the place where Medicaid managed care is going to roll out. And we have a bit of a delay because we've had some conversations about the budget here in North Carolina that have delayed that. But that should roll out on February 1st. Our office is actually going out to rural communities with some of the Medicaid Transformation staff to make sure that rural communities have the information about what this transformation looks like. So we've been holding regional meetings. We meet not just with healthcare professionals, but councils of government, economic development folks, county commissioners, and just trying to take the conversations that we hear as part of questions that come up as we're out in the field and try to get answers to those questions. So that's a lot. We've been trying to get people actually trained on what might be coming up through Medicaid, whether it's a practice or a rural health center or a free and charitable clinic or a community health center. We've kind of work across safety net groups. So that's been it takes a good amount of our time, but it's the best kind of thing that we can do to help answer people's questions and alleviate their concerns about making changes and how they're going to get paid.
Yeah, so it sounds like you have teams, people going out actually into the communities, rolling up their sleeves and having those conversations. Is there other things, or are there other things that you're doing to get communities involved in this?
Yes, we are. So we basically, I think heretofore, the folks that have been mainly involved in some of those discussions have been sort of the healthcare professionals or the clinics and so on within those communities. the thing that we've heard from across the state are people's understanding that Medicaid expansion could help their rural economies and counties. And so in addition to talking about transformation, we've been talking about what are the ways that Medicaid expansion or healthcare coverage expansion can actually assist these rural economies and communities. So we've really engaged. When we go out to talk with folks, some of the first people that we talk to are councils of government. And particularly, we begin to say, what are the things that your community needs? What do you need to know? How can our office help in getting you to that place? And in addition, understanding that healthcare and providing health is a way of developing economic development within our county or region. So we have lots of partners from economic development. We have lots of partners. We partner with Appalachian Regional Commission, but we also engage our partners across state government from Commerce, Department of Information Technology, Transportation to work with their regional representatives in those communities so that we're not just engaging just the healthcare providers. We want to make sure that what we do is sustainable in the community. And we know we can't do that with one stakeholder group. So we go out and actually set up meetings to create plans within the county or the region about how some of this can roll out.
Very interesting. Sounds like a lot of work, but good work at that. Thank you, Maggie. Right now, we're going to take a short break. Then we'll be right back to continue our conversation with today's guest, Maggie Sauer, Director of the State of North Carolina Office of Rural Health. Rural health is known for its innovation, and that's one of the exciting things about working in rural health care. And of course, innovation comes in many shapes and sizes. And today, I'd like to talk to you about two rural health leadership innovations. The first one is the National Rural Health Association's Rural Hospital CEO Certification Program. If you were at the NRHA meeting in Kansas City back in September, Alan Morgan, the CEO of NRHA, announced the creation of the Rural Hospital CEO Certification Program. And the timing could not have been more perfect. Rural hospital closures are at an all-time high. A record number of rural hospitals are operating at a loss or at risk of closing. Nearly half of all current rural hospital CEOs are CEOs for the very first time. And hospital CEO turnover leads all industries. So this program is designed to assist current rural hospital CEOs solidify their expertise, especially in these ever-changing times. And it's also designed to help create a pool of qualified rural hospital CEO candidates. Now, the program was developed for current and aspiring rural hospital CEOs by successful rural hospital CEOs. So it's a great program with a great curriculum. It kicks off in February of 2020. Applications are coming in much quicker than we had anticipated, so don't wait until it's too late. Go to www.ruralhospitalceo.com to find out more, and you can also fill out an application on that website. And of course, you can always email me directly to find out more to bill@billoxier.com. Now, the other leadership innovation I wanted to talk about is a boot camp that's coming up January 22nd through the 24th in Atlanta, Georgia. And the name of this boot camp is Leading with Impact in a Disruptive World. This boot camp is designed for clinical leaders, healthcare professionals, hospital administrators, vice presidents, and C-suite executives who need to learn new skills and strategies to lead change and healthcare transformation required to survive in the new value-driven world. The boot camp will provide a field guide of essential tools for defining transformational opportunities, leading high-functioning teams, and using evidence-based practices and outcomes measurement for effectively communicating and fostering a change agenda. It's also perfect for individuals transitioning into administrative roles, management roles, executive leadership roles in rural health. To learn more, to register for this program, you can go to www.health healthcareleadershipbootcamp.com. Or once again, you can always send me an email to bill@billauxier.com. That's BILL@BILLAUXIER.com. Don't wait. Take advantage of these two innovative programs today before they fill up. We're having a very interesting conversation today with our guest, Maggie Sauer. Maggie is the director of the State of North Carolina Office of Rural Health. Right before the break, she was talking about how her office is getting the community involved in different endeavors in the Medicaid Transformation program that's taking place. You know, one hot topic of late, it seems like, in rural health care is obstetric care. Can you talk about that? What's going on in North Carolina with obstetric care?
In Western North Carolina in particular, Mission Hospital System ended up selling their hospitals and operations to a for-profit entity called HCA. And before that happened, actually, there were 5 hospitals in rural Western North Carolina that closed their obstetric units. And in the eastern part of the state, we were just notified today that there's another obstetrics service that will be closing in Martin County Hospital. And we had another one that closed last year primarily because of hurricane damage. Mm. And so as we've had these discussions and as we know that people in rural communities, their care and their ability to go to a hospital for their care that's more local is definitely tied to long-term outcomes. And so obstetric care is critical because as we look at rural economies, how are people going to sign up and stay in a rural community, in a community that has a lot of vitality and opportunity to grow if they can't have children there? So it is about the level of care that's available to people, certainly within their communities without traveling great distances. But it's also about economic development and the opportunity for people to have children and have families in rural North Carolina.
Yeah, that's obviously pretty important, isn't it?
It sure is. It's something that we're spending more time thinking about, and in fact, we're pursuing some other grant monies and things to find out what it is that we can do as a state. And I know nationally there's federal legislation that's going through right now. HRSA just offered, and I think announced today, about their Rural Moms program. So I think it's something that we all have to really pay attention to.
Absolutely. Well, thank you for bringing us up to date on what's going on in North Carolina. Can you talk to us about the Hometown Strong campaign?
Sure. So Governor Cooper's been in office about 2.5 years ago, and part of what he did when he came in was say, we've got to pay more attention to rural communities in North Carolina, and we've got to bring state government together in order to do that. And so we have the Office of Rural Health as part of DHHS and other departments across state government have now gone to over 40 counties in North Carolina to talk to them about what their issues are in a rural community, what it is that state government can bring to support them, and because we don't want to create that conversation from Raleigh. We want them to create the conversation about what's important to them. Right. And so we go out, and sometimes the cabinet secretaries and the governor will go, but we create action plans about, anything. For instance, North Carolina just experienced this 3rd hurricane in 3 years, and with Hurricane Dorian. And a lot of what we've heard about in the last about year and a half, 2 years, has been what are the storm preparations that we can do? What is it that we can do around basic things like drinking water and wells and all those kinds of things? And also things from DSS and issues that we have with regard to substance abuse in people's communities, children needing to go to foster care, also the opportunities to look at getting people back to work after they have a substance abuse issue. So we all convene together as a team with county officials, local communities, to decide what it is that we can do across state government to do that. And so that's the other thing that has come up from Hometown Strong is really obstetric care and looking at it, across the board with regard to economic development and other ways that we can be supportive, even to, children who are born because of substance abuse issue or born into situations where there's a substance abuse issue. So we're really grateful for the opportunities also to take what HRSA has done with the rural community outreach grants that they've funded for rural communities around substance abuse. So we get a chance to wrap all that together. And I think that's the most important piece is really how do we tackle these issues together?
Yeah, it sounds like it's got an appropriate name, Hometown Strong. So that's a very interesting program that you're working on. What are the opportunities to work within the state government? And you were talking about DHHS in assisting rural communities. What are the opportunities there?
Well, I've learned a lot, Bill, actually myself, participating in these meetings. But one of the things that kind of resonates across rural, I think these days, we've spent a lot of time talking about it, is broadband coverage.
Yes.
And it's been amazing to sort of see where all of those opportunities can land or promote broadband coverage when you look at it from different lenses. So one of those, of course, with the Office of Rural Health and DHHS is because in our Medicaid Transformation, our CMS grant waiver or our CMS waiver, we talk a lot about telehealth and opportunities to get people to point of care and the opportunities to overcome what we know can be difficult if there's lack of physicians, nurses, any kind of care basically in a rural community. What are the opportunities to get people to care? And that may have a telehealth lens as part of that. And that piece has really united us with commerce because we know that broadband is that piece that can help employ people, can help, from afar. I mean, one of the big things is you may be able to provide a job for one member of the family, but if the spouse can't work, sometimes people don't come. So it becomes an economic engine. DIT, in terms of looking at broadband infrastructure, we're doing a review, particularly in Western North Carolina, of where broadband nodes are and who's doing what with telehealth so we can look at building out that infrastructure. And the piece I didn't know about was transportation, because along these highway corridors that they build, they can build in, lanes and include broadband structure along those highways. So it's been a really interesting learning experience, but that's one of the most common places.
Very interesting. So what are some of the innovations that you think rural communities need to do to move toward to remain sustainable?
So we're trying to refocus our efforts. We have some state-funded rural health centers. So there are federally, designated rural health clinics, community health centers, that kind of thing. And we are lucky in North Carolina, we do have some state-funded rural health centers that we can designate with state dollars to do that. Okay. And so what we're looking at going forward are a number of things, because some of those folks who we've established are now community health centers, and we're looking at other places across the state to establish a rural health center. And those would include basic infrastructure things like ensuring that there's broadband there, because we've got to look at telehealth and patient monitoring and those kinds of things, so we can limit the amount of time sometimes that people actually have to spend coming in. That there's creating a culture of a center where people are able to get medication-assisted therapy, so that they can return to work with their disorder and return to a normal life and support with their families. The other thing is recruitment and retention. So these rural health training programs, we've been involved talking with people across the state around graduate medical education, as well as our loan repayment program here in North Carolina and area health education centers. So that rural health center, I think, has such a tremendous opportunity to create a link with a university affiliated program that can continue that relationship, because that relationship with that entity will continue to actually support workforce development in that location, as well as give people an opportunity to have collaboration so that those folks who are working in rural communities don't feel isolated. So I think that's the other piece. And I think the fourth leg to that stool that goes along with transformation is the connection to community, which is that it's healthcare providers are so smart and they're so good at what they do, and community health workers who know their rural communities, who know what the resources are there, that if they are considered part of the healthcare team, I think that can be a real game changer also for our rural communities.
Yeah, absolutely. You know, we've been talking about what rural communities need, like broadband and that sort of thing. What are the assets that rural communities have that are models for other communities?
I get a little emotional about this because I haven't grown up in a rural community, but I tend to think that there's lots of things about rural communities that you can't necessarily quantify, like we'd like to quantify with other things. But I think the tenacity, the spirit, the community collective will of wanting to fix things, and when you get to a larger setting, like I'm sitting here in Raleigh and we have 3 or 4 health systems, and trying to get them to cooperate around some things is not the easiest thing to do.
Right.
But I think the thing that rural communities do is people are committed to their community. They're committed to the people in their community, and people volunteer across the community. I mean, I think about where I grew up, and, someone gets sick or someone passes away. And so that's another layer of care. I think that is, it's not that it doesn't happen in urban areas, but it certainly is, I think, a very real and tangible thing in rural communities. So I always like to think about an asset-based assessment of rural, not just what they don't have.
Absolutely. I couldn't agree with you more. Thank you for sharing that with us. So Maggie, what scares you the most about the future of rural health?
I think I'm going to go back to the leadership piece. And I don't mean that there's no leadership in rural. I just feel like I'm always particularly bolstered when I talk to young people who are interested and really engaged in this discussion around rural health. Because I think we, as a nation, we have to understand how incredibly important our rural communities are to us. And they help us create healthy food, for the nation.
Yes.
They help us create other opportunities around, transportation, wind production, and I just think that it's important for us and the nation to understand that rural fabric is so critical to our nation. And I think the second part of it is the leadership piece. I was, and sadly, but in a good way, I was out at Ocracoke Island a week ago on Saturday for a fundraiser for the health center out there. And the reason, the good side of that was you should see the people who showed up for that fundraiser. I mean, so Ocracoke is just off the Outer Banks, and you have people who came from the mainland to come over and support because they do a lot of work together. I mean, it was such a tremendous demonstration of community strength and willingness and pride in that health center. And I talked to their CFO, and he talked about his wife growing up in Ocracoke. He didn't grow up there, but what pride they had. She's a teacher there now. And he told me about some of the other folks he went to school with who are now pursuing interest in rural health. The unfortunate thing is that during this recent hurricane, Ocracoke was really, really devastated in this hurricane. But I will tell you that it's going to be because of the strength of that community and that the stick-to-itiveness of that community that they will come back.
Yeah.
And so I look at leadership, and I think that's one of the most important things that we can do is instill and support young people to move forward in a leader in their communities.
Leadership does make the difference. There's no doubt about that. Well, that's what scares you, Maggie. What excites you the most about the future of rural health? All
of those things.
Okay.
Yeah, I mean, I think, like I said, I kind of said it in my previous remarks, is, at the office in the last 2 years that I've been here, and I'm sure it happened before this, but this is just my experience, we have had numerous young people contact our office and say, we want to be engaged. We want to understand more about rural and what the opportunities are. So I think people are really paying attention to rural in a way that they haven't necessarily before. And I have a high school sophomore who contacted me this year and said, I want to get started in this. And this is a young woman who lives in an urban community.
Oh, wow.
So I'm really, really excited about the fact that people, I think, are hearing this and want to be engaged. I'm really excited about the partnerships that we have here in North Carolina, and just really proud of the opportunity for us to work with other people. So those two things, I think, just there is an awareness of the leadership opportunities and needs in rural, and people's awareness about it in a different way. And we're having conversations differently, I think, than we used to.
Yeah, that is exciting. Thanks for sharing that with us. Maggie, we've covered a lot of territory in the short time we've been talking today. If our listeners only take one thing away from our conversation, what should that be?
Rural counts. Yeah. I mean, I know that's kind of taking a hashtag, but rural counts, whether it's the fish that you're eating on your table, whether it's your farmers, whether it's, any of those things, that people in rural are just amazing and should be held up as true leaders in our country.
Maggie Sauer, Director of the State of North Carolina Office of Rural Health, thank you so much for joining us today.
Thank you so much for having me. It's a real privilege.
I want to thank you for sharing your expertise, your firsthand knowledge about leadership in rural health. And I want to thank all of you out there for listening today. If you enjoyed today's episode, please go to iTunes, Stitcher, Google Play, whatever your favorite podcast app might be, and subscribe to Rural Health Leadership Radio. And if you'd like to continue the conversation of leadership in rural health, you can also join our private LinkedIn group called Rural Health Leadership Radio. And while you're on Facebook today, we love likes. Yes, Rural Health Leadership Radio has a Facebook page, and so we'd appreciate it if you'd give us a like. Until next week, let's keep working to improve rural health, one conversation at a time.
If you would like to connect with today's guest, please send an email with your contact information to bill@billoxier.com. If you would like to be a guest or suggest someone else as a guest, have a question you would like to ask, or simply want to contact Rural Health Leadership Radio, please use that same email address, bill@billoxier.com. That's BILL@BILLAUXIER.com. You can also visit our website at www.rhlradio.com.
And we'd ask that you please support our sponsor, the Dynamic Leadership Academy for Rural Health. The Dynamic Leadership Academy for Rural Health's mission is to improve rural health, one leader